Hi all, good evening. Welcome in the next another episode of Felix Talks. Today we have a renowned dermatologist Dr. Kusum Gupta जिनसे हम बात करेंगे आज डर्मेटोलॉजिस्ट के रिगार्डिंग और डर्मेटोलॉजी की कुछ इश्यूज और प्रॉब्लम्स के रिगार्डिंग राइट हाउ वी कैन ओवरकम ऑन टू दोज एंड व्हाट कैन बी डन सो फॉर दैट welcome, doctor. Let's start with the first question. Doctor, before proceeding further, I would like to know, so what basically dermatology is all about?
Dermatology, it comprises basically conditions and disorder which are related to skin, hairs, nails, and mucous membrane, and it involves all age children and adults. In previous era, मतलब पुरानी ancient time में, dermatology was a domain of general medicine for many centuries. Then after 18th century, there then comes School of Dermatology in Paris. Then derma came in play.
Okay, great. Thank you so much for the information, doctor. So as doctor said, in earlier era, general medicine used to do this derma things. So I remembered one thing, doctor. Doctor Shushruta, the ancient surgeon, used to perform. Yes.
He was surgeon.
I read he used to do rhinoplasty. All these plastic sort
all
of
surgeries,
treatments.
instruments, all procedure are there in Shushruta Samhita's book.
So with this we can conclude कि लोगों को अच्छा दिखने का शौक काफी पहले से रहा है.
Exactly. It's before that Cleopatra at that time, ancient time से ही people used to
and it's evolving with time.
chemical peeling, etc.
So next move on to the next question. What are some misconceptions जो लोगों को होते हैं dermatology के regarding?
Yeah, in dermatology there are multiple misconceptions. I mean, if we talk about few, first one is people apply fairness creams, the Betonite M, GM, Globe G, Melalite, Skin Light. They think these are good. I mean, they skin का color fair होता है, glow आता है, but this is all wrong.
Myth है.
All myth. Actually, it damages the skin. Skin thin हो जाती है, skin पे hair आ जाते हैं, redness आ जाता है, pigmentary changes आ जाते हैं, and those are permanent. Once skin is damaged, it's damaged. We can't come back to that original skin after that.
Okay, so I guess doctor with this we can conclude that every skin type is different.
Exactly.
So one should consider dermatologist before taking any sort of medication.
One should go to dermatologist if any skin condition is there, especially for face.
Correct. So folks, if you want some glow up and all, so always consider your dermatologist first before taking any medication or cream on your own. Right?
Exactly. Great. Especially on face.
Great. Thanks, doctor, for the response. Let's move on to the next question. Doctor, for a much healthier skin, what are some basic lifestyle tips which you would like to give?
There are many. I will give good tips. Like first one is mild cleanser. Cleanse your face at least twice a day. Then moisturize it properly. Then sunscreen. Always apply sunscreen. In the morning time, sunscreen is mandatory. Then hydration.
Correct.
Yeah, proper. I mean,
hydration.
8 to 10 glasses of water a day. And healthy diet which is rich in vitamin C, protein, omegas, etc. And last one is sleep. Sleep is very essential. I mean, 7 to 8 hours sleep for every individual is very important.
I've read like a good sleep leads to a healthy lifestyle.
Sleep.
Right.
Exactly.
Sleeping Beauty came from there itself. Great. So next, move on to the next question. So doctor, how important the role of sunscreen is in our daily life?
Sunscreen is very important part of our daily routine life. Actually, nowadays, UV rays and UVB rays are very harmful, right?
True.
So sunscreen protects us from sun aging and photo sunspots like freckles, lentigens, melasma, loss of elastic tanning, early aging, wrinkling, fine wrinkles. Those things are due to sun exposure. So, and last one is skin cancer.
How?
So it protects us from all those things. So sunscreen is very important.
So it's not like that one should use this sort of sunscreen only in summers, but in winters
too. All time. Even it's cloudy
it is an essential.
Day, all time.
That's a good insight, I must say. Thank you so much. Let's move on to the next. And what are the most common skin conditions you usually see in your practice, doctor?
Common ones are hair fall, can say. Hair fall, acne. Hair fall is very common in Noida, especially. Noida's water. Like acne and eczema. Eczema it's very common. In winter, psoriasis is very common. And summer में fungal infections, tinea,
Correct,
ingroins,
correct,
itch.
correct. Each
That
and all.
fungal, yeah, exactly. And these
These are some basic ones.
acne in teenage,
Acne to is most
acne
common.
scars, these are very common.
Got it, got it. So as you said, in contrast to this question, I would like to relevant one point with this. Like as you said, if one can maintain healthy lifestyle, then all these things can be avoided.
Can be, exactly.
But people often, unable to follow these sort of healthy lifestyle
Exactly,
things, due to which they may face issues.
exactly.
Agreed. A good insight. Thanks. ठीक है. Next question. But can you shed some light on acne management? Like usually ये है जो आप बोल रहे हो teenagers में भी है and basically हर age group में भी है. So क्या basic चीजें हैं जो client से कर सकते हैं वो?
एक्ने में पता ही नहीं होता है what to do and what to not do.
True, true.
So I'm giving quick steps के what to do and what not to do.
I'm sure would be much helpful.
Exactly. Those may one should cleanse the face twice at least, no, not
Agreed.
overdo.
हाँ,
Right. Then moisturize, sunscreen, and change the pillow cover frequently.
Okay.
And clean the phone, mobile phone, and if female is there and having acne, then clean the makeup brushes
Okay.
and healthy lifestyle. Like in don'ts, we can say one should not pop or pick the acne. It will leave acne scars. No, one should not use toothpaste. It's very common in home remedy. Na people
True,
used to
true,
do
true,
कि
true,
toothpaste
true.
लगा लेते हैं वो settle down हो जाएगा ना.
Agreed.
Aspirin वो उसको क्रश करके they apply aspirin and betamisol steroid ना, तो उससे वो और इरिटेशन हो जाता है, उससे और डीप स्कार्स हो जाते हैं, तो लोगों को पता ही नहीं होता है what to do and what not to do.
Absolutely. These
should
can leave a long lasting impact
Exactly.
on their appearance.
Exactly.
So these are, I'm sure the one who used to do these kind of mistakes, they are not aware of na, to have these kind of detail like cleaning the mic, cleaning the makeup
brushes.
that phone cover changing and all, but they play a major role.
Exactly. These are small things, but play
matters a
major
lot.
role. Exactly.
Well, thanks for sharing it. I'm sure I'm gonna follow these tips from today onwards for myself too. Chaliye, next question. So, doctor, how can people usually recognize the early sign of serious skin conditions like skin cancer or somewhat?
Yeah, skin cancer. Skin cancers, these are mostly over sun-exposed area, like head and neck, exposed forearm part, in that area, like. And if somebody is having any existing lesion like mole, and if there is any change in size, skin color, texture, it's rapidly growing in size, color is changing, like it's getting darker.
So one should not avoid the symptoms.
So one should go to dermatologist.
Absolutely. मतलब they think like कि अपने आप ठीक हो जाएगा, चला जाएगा, घरेलू कुछ कर ले.
Previously, skin cancers were little less in India, and it was more common in Western side because there is no less of melanin in the skin. But nowadays, skin cancers are increasing in India also. So one should be aware of that, and if there is changes in existing lesion or having some new lesion, one should go to dermatologist.
Rather than just waiting कि अपने आप ठीक हो जाएगा या घरेलू नुस्खे कर लें. Eventually, it will increase the problem.
घरेलू नुस्खे तो बिल्कुल नहीं करने चाहिए ऐसी चीज़ों में. One should definitely go to.
So, हमें अपना स्पेशलिस्ट खुद बनने की जगह एक्चुअल में जो स्पेशलिस्ट होते हैं उनको दिखाना चाहिए to avoid problems for yourself and as well as for your loved ones, I would say. Well, thanks, doctor. Let's move on to the next question. So, doctor, what are some exciting advancement in dermatology and skincare treatments?
There are many advancements. One is laser innovations. Lasers is working in all the aspects. I mean, facial hair reduction, pigmentary changes, freckles, linkages, melasma, acne scars, nevus, tattoo removal. It's working in all the variety, right? And PRP,
platelet-rich plasma.
Platelet-rich plasma. It's very good at scalp hairs and also good for face also.
Okay.
And biologics. Biologics, it's a new tool. Biologics, these are substance जो कि living organism के ही product से synthesize किए जाते हैं, and it target if there is any disease, like if we say psoriasis, है ना, this pathogenesis of psoriasis.
Absolutely.
So biologics target a specific, it's a specific targeted therapy, and the pathogenesis target a specific receptor, or I can say mediator. One specific step it blocked in the pathogenesis role, and then that
It can
diseases-
prevent the spreadness of that particular
exactly
thing.
diseases stop. So this is
Great.
new.
Great.
Biologics therapy is new.
Well, a good detail, I must say. So I believe that our technology is moving in the right direction.
Exactly.
In contrast
It's a
to
very good thing.
dermatologists, no?
Biologics are very good. It's a new thing. Psoriasis, multiple cancers.
Good detail, doctor. Thank you so much for sharing it. Next, can you share a memorable patient success like that a patient had a particular significant impact because of your suggestions and all?
Uh, yes, there was one patient. When I was doing my MD, that time there was one patient. She
In
was
the beginning of your practice.
yeah. She was admitted in college. She was early 30s, I guess 30-35 के range में थी, and she came with the 10 toxic epidermal necrolysis, severe drug reaction. There was peeling all over the body, oral, mucosa, eyes, है ना, पूरे body peel हो रही थी. So she was not, बहुत serious थी when she came.
Absolutely.
तो
No, I can
लग
imagine
नहीं
the
रहा था.
way you were telling.
So 45 days approx she was admitted in the hospital. So we used to dress and everything, dressing is सब कुछ, steroids, antibiotics सब चला. Then at the last she survived and we discharged her on the proper treatment, discharge किया. Then 2 months after 2 months she was back. है ना, तो she was very beautiful. We
Okay.
couldn't recognize her. ना, कि
Post
you-
recovery.
So she gave, I was there, no? I was on that bed. Oh, she is that. So she came with the gift. She was working in Acne actually, no? So she came. So we denied we can't accept gifts actually. So we
Absolutely.
denied कि नहीं नहीं. So she was very happy. She was very satisfied. पहले कि मामा बच के आ गई घर वापस.
I can.
So we were very happy that time. कि
Well, this sums up that why लोग डॉक्टर को भगवान बोलते हैं, है ना? It somehow give them their lost confidence or aura which they want to live in, but due to that particular condition.
that moment is very precious.
नहीं, नहीं,
It's
absolutely.
very satisfactory when somebody says ना
हाँ,
कि
नहीं,
मैं यहाँ
नहीं, true.
से ठीक हो गया,
And because of
तो
you.
exactly.
It's absolutely miraculous. Naini, that's great. Thank you so much for sharing it. It was indeed a good experience to know. Well, let's move on to the last segment and the last question for this. So usually in your day-to-day practice, what type of challenges you may face while interacting with the patients?
Challenges.
As a
The
dermatologist,
biggest challenges. Patients' expectation. I mean, few patients comes with very high expectation, है ना? So we have to make them understand कि इतने results नहीं होते हैं इस चीज़ में,
Got
है ना?
it.
और it takes time. Suppose if somebody is coming for hair fall, है ना, तो response is not drastic. It will take time, है ना? 1
Absolutely.
month में थोड़ा hair fall कम होगा, then नए hairs
Slowly,
आएंगे,
slowly it would be
तो 3 months
on
तो
track, हाँ.
3-4 months तो we have to wait.
Correct.
So we have to make them understand because they will come again ना 1 month
With
की
those
नए
expectations
बाल,
only,
नए बाल नहीं आए.
Correct,
1 month हो
correct,
गया,
correct,
minoxidil I'm applying, still I'm not feeling कि नई growth हुआ. तो उनको समझाना पड़ता है. ऐसे ही in acne scars also, if somebody is having deep acne scars, है ना, तो they expect कि once treatment started, तो it will be 100% gone.
Absolutely.
तो they have to make them understand कि 65% और maximum 70%, कि उससे ज़्यादा back to normal skin जो पहले थी वैसी आ जाए, वो नहीं हो पाएगा.
That would be तो obviously
नहीं हो
difficult.
पाता है,
हाँ.
हाँ, क्योंकि it's very deep dermal damage.
Correct,
नहीं आ
correct,
पाता है, तो समझाना पड़ता है ये चीज़.
So sometimes bridging the gap of those expectations might be
Exactly.
heavy.
That is
है
tough.
ना?
That is tough.
Agreed. So this may sums up that how a particular specialist may face an issue or a particular doctor in bridging the gap of the expectations, like what the patient may have in their mind and what the doctors are doing in comparison to that. So it's really challenging, and we appreciate the core doctors like you
Thank
who
you.
are
Thank
working
you, Ankit. Thank you,
towards
Ankit.
bridging their gap.
Thank you.
And I just hope you do wonders in your future, doctor.
Thank you so
And
much.
we will be meeting on further in enlightening some more facts on dermatology.
Thank you.
Well, I hope this session would be enlightened for you all as well. And with this, we will take your leave. Thank you so much for joining in and watching the same. Have a good day and have a good life. Thank